All right, we are live, I think. Right,
It's
so
so.
welcome. We hope so. So welcome to Now Written Live. I'm Ashish Rishi, the founder of Unwritten Health. So before I get into introducing our guest today, I just wanted to explain why I started this series. And it's because I believe, and this is my personal thesis, that the people most failed by healthcare are also the ones that are the least visible when it comes to research and the data. And that gap between what the system records and what actually people experience is where we need to really improve when it comes to healthcare or clinical trials or patient engagement. So that's what I'm doing. So what I'm trying to do with these weekly events is put that story on the record. So it's not unwritten, it's now written. You see, you get it? You get it? So each episode is one guest and it will be an unfiltered chat. Today, I've got the lovely Sahara, who has lived with ulcerative colitis for a long time, but she'll tell us a bit more. Also navigated an ADHD diagnosis. That reframed, I think, your journey and your experience, and sadly come out the other side with PTSD, which you attribute directly to your experience. Sahara is also, like for me personally, one of the most honest people I've spoken to about what the system does and when it does not know what to do with you. So Sahara, welcome to Now Written Live. Anything else you want to add to that? If you could just, introduce yourself.
I think you've hit the nail on the head, about the gaps and people very easily sliding on through them. So a brief intro to, and apologies in advance because there are 4 dogs in this room. Because apparently we needed 4 dogs. We bought 2 new puppies 9 weeks ago, and they are prone to outbursts. So I will apologise in advance for any of that mischief, but they're so cute. So, my name is Sahara, and I was diagnosed with UC, a form of inflammatory bowel disease, in 2007. Subsequent diagnoses of things like fibro and PTSD and ADHD and bladder muscle dysfunction and all the things that come along with scar tissue and lots of different abdominal surgeries. I have been in the advocacy space since 2014, which I only really kind of entered because of the gaps in the system, because they were saying you need to have surgery and there's no more meds. And I was like, well, I'm going to go and find out from the people who know. And then I've been working with healthcare companies since 2019.
Excellent. So let's dive in then on the, let's start with UC, if that's all right with you. So can you tell us a bit about your journey and when did it start? I know you briefly mentioned you've had it for a number of years. And what was the diagnosis, what the early years actually like for you?
I was actually really lucky. No, I wasn't. But in a sense, I was really lucky in that I didn't have this long period of time where I was struggling with symptoms, going back and forth to a doctor and trying to beg them to believe me. My disease progressed really rapidly within the space of a week. So first there was diarrhea and there was blood, and then I was unable to eat. And then I went to A&E and I was diagnosed, and less than a week later I had my colon whipped out. So that, I was 19 at the time, so a bit traumatic considering, not a bit traumatic, a lot traumatic, considering all I'd ever had before that was a cold. I'd never been to a hospital for any other reason other than to get a piece of metal out of my nail. So that was a shocker. I didn't know anybody else that had a stoma, which I'd now been left with as this 19-year-old. And it sounded, when I spoke to anybody about it, like something that was for old people, not for me. And, it was assumed there were a lot of stigma attached to it. So it was smelly and it was for old people and all the fun. So my early journey was actually rapid, traumatic. There was a second surgery that I needed during that first inpatient stay because of sepsis. Some of the trauma that I'm sure we'll talk about later was all wrapped up in just that first stay when people weren't listening to me. And thank God for the nurse shift change when somebody finally did listen to me and ran me around, dripping morphine into my mouth, got me the right tests done. And that's when they found the sepsis and I needed another emergency surgery that, I'd been invalidated for half a day or at least before that, with people just saying, but they're there, you're going to be in pain, you've just had surgery. Like I didn't know that I was improving and now I was getting worse again. I feel like I've gone totally off track, and I'm already starting to rant about
you're good. No, you're good. Because I was actually going to ask, as a 19-year-old, what was that like, though? Like you've got your, I would imagine, social life, whatever it was, college or whatever it might have been. What was that like for you?
To be honest, my social life was mainly drinking. So that was what I did in my spare time. I did a lot of drinking, some recreational drugs, and I smoked a lot. So it did have an impact because it was my confidence and the bag itself. Bags that we have now are completely different to the bags that were available then. Like they had really thick base plates and they'd crease up, and then poo would creep out of the side, and before you know it, you're in a supermarket or you're at work or you're in the pub and you're covered in poo. So that's not okay for a 19-year-old. I was really uncomfortable with all of the clothes that I owned before the surgery. I was very, very aware of this bag. I've always been like really slender. So the bag did protrude a little bit more on me, I think. The place that it was, I'm really short. I'm like I'm going to say 5'2" because I'm rounding up. So where it, like the waistbands on my trousers sat in a weird place. It was all, I don't want to use the word traumatic again. But when I look back at it, it did feel like that because I ended up completely isolated. I didn't want to go out anymore. I didn't want to go to work. I didn't even want to do the supermarket runs because of the leaks. The leaks led to burnt skin, which would then weep, and then the bags wouldn't stick again. It was like I had suddenly lost every part of me that I knew. And I didn't realize at that point that I wasn't going to be able to go back to normal. Like I knew they'd taken my colon away. Didn't have the internet in my pocket to really even understand what that meant, and it wasn't really explained to me. I was told that it could be reversed later and that I was cured of ulcerative colitis because they had taken my colon away. So that was the information that I had, and that's what I was going with. So I was basically just, the whole time that I was feeling really crap about myself and not engaging with life anymore, I was like, it's fine because I can get a reversal and then everything will go back to normal. It was only when the reversal actually came that I realized that that wasn't the case. But it did literally just put a stop on my life. And it's like I was on pause, waiting for the reversal to be able to go back to my old self. Because that was the belief that I would go back to this old version of me.
Yeah. And so just if anyone doesn't understand UC, so what happened at that reversal stage? Why didn't it reverse?
I thought a reversal was going to be quite simple, and you would take the end of the stoma and you would connect it back up inside, and that would be it. But it turns out if you've taken the whole colon, and the rectum also needs to go because that was also inflamed and bleeding and ulcered. So then they need to create a replacement rectum out of small intestine, which is commonly referred to as a J pouch, which then needs to heal in situ, and then at a later date, the stoma is connected to the J pouch, so that you can empty normally rather than everything just running through. Like it needs that storage area. So I found that out, I think maybe a year after the surgery, because it had taken me an awful long time to gain the weight and get to a healthy enough point where I could have another surgery. And at that point, the surgeon drops the bomb that you're probably not going to conceive naturally if you do this surgery. So maybe you want to think about doing the child thing now. And I did try my very hardest to think about it. I didn't imagine my future to have no children in it. That didn't feel like a future that I even wanted. But at the same time, I was 19. I was in a relationship, but the relationship we'd been together for 3 months before the surgery had happened. He was an alcoholic. It was very toxic and very bad. But I was too busy being wrapped up in everything that was going on with me to even realize how wrong that was. I was also brought up in a home with alcoholic parents. So it was the norm for me to do all this toxicity and all of this arguing. And even sometimes, violence was involved and all sorts of things. I know you said I was honest, and we're really going in there now. I don't even know where I was going.
So talking about, what the experience was like, how you felt, and why the reversal couldn't happen. So they've obviously told you that, if you want to have children,
it was the fertility thing, wasn't it?
Yeah.
So we did very briefly try to conceive because I was like, I can't not have a child ever. So we kind of need to get on with it now. I did conceive and had a miscarriage, which was the worst thing for me, who was already not in a good headspace. So then it was like, I mean, every month had already been really torturous anyway. We didn't try for long, but it was like every period that came felt like I'd lost something that I'd not even had. So like you're building your hopes up. And then I was finally pregnant, but by the time we found out I was pregnant, it was basically gone again pretty quickly. So I was like, I can't go through that again. I don't want to live with these leaks and all of this burnt skin scenario. So I'm just going to go ahead with the surgery. So I did, but it was 2 years with that first stoma. So I had the first year where I recovered and got to a point where I was relatively well. Then there was a surgery to create the J pouch. And then there was another year whilst I got to a point of being relatively well and waiting to see surgeons before it's connected up again. So that first stoma was 2007 to 2009, but there was the surgery in between.
And I assume 19-year-old Sahara wasn't told this information at the time.
I didn't get a lot of information, to be honest. When I was diagnosed with UC in the hospital, they gave me a booklet that basically said, with, you know, a few dietary amendments and the right medication, you'll probably live a normal, healthy life, which made it even more shocking when less than a week later they're saying we're going to whip your colon out and give you a stoma and a bag, which they'd not mentioned up until that point. It wasn't in the booklet either, so that was a surprise.
Yeah, so that must have been hard. So I think that leads us on to our sort of next question. Let's start with the positive. What did the system or healthcare get right with your journey?
I do not want to sound ungrateful, because we have a free health service, which, you know, plenty of other people do not have. So they saved my life, and there is absolutely no doubt about that. I've had multiple surgeries throughout the years, 7 surgeries throughout the years. And my life has been saved on multiple occasions. There was that absolutely wonderful nurse that heard me and rushed me around. And again, that one woman, I think, saved my life. You know, potentially another nurse shift changeover, and maybe someone would have listened to me then. But I don't know whether that would have been too late or not, because it really was urgent to get that surgery. And I was so out of it, they had to ring my mum to come and sign the paper, because they're like, you need this surgery. And all I could think was, I can't sign anything right now because I don't know what you're saying to me. So it was bad. So that woman saved my life. And I had a really good health psychologist, and this was only last year. And I went through many different counselling, therapy, psychology services before this. And I really had to fight to get access to him. But when I got access to him, he was so helpful. And I started doing eye movement desensitization and reprocessing, EMDR for short, which is available on our health psychology service, at least around here. So I was lucky to be able to access that. He was lovely. I genuinely did feel like someone was listening, which is I've not experienced through the other counsellors and therapists and things that I've seen before. I feel like there must be more, right? Like more things must have happened. But everything is just so wrapped up in, invalidation feels like the best word, that it does all get overshadowed by the crap instead.
Yeah, and I suppose you're in an emotional state as well, so it's hard to see the good sometimes as well.
Yeah.
All right. What did they miss? What did they get wrong?
I mean, obviously, I've given you the example of the sepsis already. A lot of the time, it was inpatient stays more than anything else, where you felt like an inconvenience. I felt like an inconvenience to nurses. And there was something about my age, because I was on wards where there were often people that were a fair bit older than me. It was always just assumed like, oh, she'll just fend for herself. But, you know, I've just had a surgery that these old people haven't had. But they were getting the support that I wasn't getting. Even just simple things in the morning, like, can we help you with a wash? That wasn't even an offer to me. It was expected that I was going to get up and I couldn't even walk. So I don't know. My mum was coming and strip washing me with baby wipes and things. Most of the time, it's just not being heard, whether that's been as an inpatient or even just in primary care. It's not being heard. And that does just overshadow everything else. And when you know that you've got to fight to be heard constantly, it's like, I tell everybody else that, you know, you've got to fight for yourself, you've got to advocate for yourself, you've got to use your voice, and I truly believe it. But I often can't make myself pick up the phone to even make an appointment, because I know the battle I'm going to have to A, get the appointment, B, to be heard when I get there. And I don't know what all the other primary care situations are, but ours, we don't have a family doctor anymore. Everybody is a locum. You don't get to see somebody that knows me at all. So it's like you walk in, it already feels like they have the assumption that you're there to moan about something that's probably not real. That's what it feels like as a patient, and that is all kinds of wrong.
Yeah, I suppose that sort of leads me on. So in our industry, you know, like I work in patient engagement and clinical trials and all that sort of stuff, and the industry focuses on the disease, the condition. You know, so they may see you as the person living with ulcerative colitis, but actually there's intersectionalities. Ooh, sorry, 1 second. Got a phone call there. Intersectionality. So you were diagnosed with ADHD alongside everything else you've been dealing with. How has that changed how you understood your own condition, and has that impacted your life?
The ADHD diagnosis was really recent. It was this year. Okay. I had I had quite a lot of people tell me that they thought I was neurodivergent, but a lot of people were telling me that, you know, the more people that have been learning about neurodivergence, I've had quite a lot of people tell me that they thought I was autistic, which is potentially true. I don't think outwardly I often portray, like, you know, the standard symptoms of ADHD, but women often don't. It's often the hyperactivity is in your head more than it is you running around like a lunatic. If you looked at me as a child or a teenager, you could very blatantly see that she's not like all of the others. It was weird because I kind of knew. I definitely knew. I wouldn't have got the assessment if I didn't know. In my head, no. But then when I got the diagnosis, it immediately did feel a bit like, I felt really floaty, like I was literally disconnected for a few days. And it felt like I don't know who I am then. And then I realized that actually I'm exactly the same person that I've been all along. It's just that now someone's given a label for some of the reasons that I might have struggled with certain things. And then I started learning about ADHD more. Now I'd officially got a diagnosis. I purposely didn't look too much into it before the assessment because I didn't want to manifest things. I didn't want to make myself into somebody with ADHD that doesn't really have ADHD. And I soon learned that, you know, people with ADHD are more likely to come out of a traumatic event with PTSD. Somebody without the neurodivergence would potentially not have got PTSD. Far more likely for me to come out of it with ADHD. I mean, with PTSD, I feel like because there's been multiple things that have been like really traumatic, probably would have got PTSD anyway. But maybe not this, maybe not as soon, because it was for me, I think it was fairly quickly that it became a massive problem, the trauma that I'd been through, and wasn't able to work my way through. But I think a lot of the time as well, in healthcare, they don't really want to explain why to you. And I think a lot of healthcare professionals don't think that it's actually their job to explain why to you. They listen to you, they listen to your symptoms, they diagnose you, and then they treat you. And I know they're lacking in time. I know that. And I know we're always running behind, and none of the healthcare professionals that we see have got the time to sit with us and explain everything to us. But for me, I need to know everything. And I always have done since a child. Like, I want you to tell me what that means, though. I don't want you to tell me that I need to take this medication. I need to know what this medication is doing and how it's working. And I always want to know why. And if they don't have time to tell me why, then I'm already struggling. And then you go away and you Google it, which is, you know, the thing that everybody tells you not to do. Because I am who I am, it means I'm not just going to go home and Google it. I'm going to make sure that the sources are reliable, and I'm going to look at research articles and journals and things. But most people don't have that. Most people aren't going to come away and spend 40 minutes reading one journal article, because I've got to open 5 more tabs, you know, to learn what most of these words mean, because it's not written for me.
Yeah. You've raised a lot there, and I think I mean, I think the answer is obvious, but do you think the healthcare system is designed with neurodivergent people in mind?
I don't think so, but I think for so many years, it's only been in recent years that we've really even known what it means. And I think the more awareness that's been brought to it and the more we understand what it means, the more people have unmasked themselves, because so many people have just been living masked for all this time. So at no point in the past, even though I knew I wasn't satisfied with how this appointment was going, because I had all of these whys that I really wanted the doctor to answer, I wouldn't have been comfortable sitting there and saying, I need to know why, though. Because I knew I needed to know why, but me saying I need to know why felt quite childlike, because as a child, when you are really inquisitive and curious, and at some point you start irritating the adults and they don't want to tell you why anymore. And I think that's in my head as well. And as somebody with ADHD as well, this kind of rejection sensitivity, and I think that plays into healthcare a lot as well, and really sensitive to anybody being remotely irritated by me. Which people in healthcare unfortunately are.
But I can imagine, I can imagine that, not that I find you irritating, but no, in the sense of, I think, we talk about advocate for yourself quite a lot. We say that, but I think it's not as easy as just fighting that fight every time, every appointment, every phone call, every appointment trying to make, and it's harder. And I think it's even harder for neurodivergent people, more difficult. So that's something that I think when we talk about advocating for ourselves, really is that are we putting the onus on ourselves and not the healthcare system then? So that's just something to
it is a very good point, because you do kind of feel the pressure then. For a long time I've been like, I know I am this person that's like, do as I say and not as I do, and I hate being hypocritical. But there's no getting away from the fact that that is what I was doing. I've got a support group full of people that I could direct to all of these resources and, go and tell to fight for themselves, but didn't feel capable of doing it for myself. And that just felt really hypocritical to be doing that.
Yeah. And then that will affect your self-confidence, self-esteem through the journey as well. So it's like a snowball effect, isn't it?
Yeah, definitely.
So God knows how many people are actually listening to this right now, but let's just assume there is someone who designs a clinical trial patient engagement program right now, and they're listening. What's the one thing you would want them to walk away and do differently from this conversation?
I mean, it's impossible to give one tip that would be good for all people with all conditions. So I think ultimately it's about bringing the patient in early as possible. And it means that it works for us, but it also means that the people designing the clinical trials don't have to keep redoing it. You don't have to spend all of this time and this money redoing something if you work with us from the beginning. Figure out how you keep your attention rates up, why people might be dropping off your clinical trials. Like, you don't understand these things unless you talk to the people that have been in those scenarios and lived it. So that's it for me. Just bring us in earlier.
And you've been in this space for quite a while. Have you seen any changes, positive changes? Like, are you being invited earlier on, or is there anything like that happening?
Yeah, I mean, I work for a company called Miracle, who are in Switzerland, and I do the patient recruitment. So I really love that I do get to the companies that are now starting to do this, like the pharma companies and the healthcare companies, and they are starting to involve people earlier. And I get to see that because I'm the one going out to find the patient and saying, come here and help this company, because they really do want to hear from the start. But that's not to say that everybody that approaches Miracle is looking for that kind of input from patients, because they're not. Some people do still, it feels like a tick box exercise still. So they want you to review this material, but the material's already done. So they're probably not going to change it anyway. So, I mean, tends to be not with the people that Miracle work with. And I feel really fortunate to be working with a company that does work like that, because if the patient's insights are not actually going to feed into what comes out of it, then there's no point in getting the insights at all. It's the waste of everybody's time.
Absolutely. No, that makes sense. And just final question. I'm just conscious of time. We've got a few more minutes, but what does good look like? If you were, let's go back to 18-year-old Sahara. You're you're about to go on that journey. What would good look like from that day to, I mean, in a short sentence, if possible? I don't know.
I think it's just being believed in the first place. It was an abdominal issue and there was diarrhea involved. So they immediately said, you have irritable bowel syndrome. But that nobody even looked. They just listened to what I was saying, and that's what they decided. I mean, why you wouldn't prod my stomach or look, I don't know. But, you know, if you're not actually going to listen to patients and take what they say seriously, then I don't really know how you can sit in that seat and pretend that you're trying to help them.
No, absolutely. So would you say it's a case of it's a multifaceted thing that we need to improve? It's the industry needs to really involve the patient earlier. Healthcare practitioners need to be a bit more, I don't know if compassionate is compassionate the right word, but yeah.
I think it probably is, you know, which is a shame, because I know, you know, people don't go to medical school and train for all this time because they're not compassionate people. I understand that the people that have been worn down by the system just as much as we are, but lacking compassion is definitely, I can't think of a better way to phrase it, to be honest.
Yeah. So we've got one comment coming. We have a comment, so someone is actually watching. From Sophie. Thank you, Sophie, for watching. Fantastic interview. I keep nodding furiously to all points made. So sadly, you're not alone with Sahara. So firstly, thank you for this time today. It feels like this half an hour has gone very quickly, very quickly.
It did, didn't it?
Yeah, it did. But I wanted to leave everyone with some research that I came across actually in prep for this event, and I found that 93% of women aged between 25 and 34 report feeling dismissed when seeking medical help, and that is not okay. 93% is ridiculous.
What an awful bombshell to leave everybody on.
I know. Sorry, I do like to end on a bummer. Yes, no, but you know, but that is the gap that what we're trying to close. Essentially, we're trying to raise awareness and we're trying to put solutions in place. So again, thank you very much, Sahara. I would, anyone watching this, recommend following Sahara on LinkedIn and the other channels. Sahara, I've never done this
everywhere.
Before. Where can they find you?
Everywhere.
I know you've got a YouTube channel, Instagram. Yeah.
Yes, and Facebook, and I would say I'm on X, but I don't really go there much anymore. No. Yeah, everywhere. I am everywhere. I even started posting videos on TikTok, so that's what I do now.
Cool. All right. I'm getting into TikTok. I'm trying to be young and trendy.
I'm trying not to open it because, you know, all of a sudden you're 20 minutes in and you're just meant to come on and
doom scrolling. Yeah, absolutely. Same. No, thank you very much. So I'll be back next week at the same sort of time. I have Ella Balassa from the US, who lives with cystic fibrosis, will be my next guest. So I just want to thank you all for being here, and just keep posting your comments in the event bit of this thing on LinkedIn, and we can keep the discussion going. Thank you very much, Sahara.
And I'll see you next week with Ella.
Thank you. All right, take care. See you later. Bye.